ठीक है. Okay. So hello students. So good evening to all of you. Good evening. So I'm Dr. Pradeep Pawar, Professor of Anatomy, and welcome to the PW FMGE Sprint series. So let us discuss some MCQ students, some MCQs and some visuals. So these are very important MCQs. You'll get to know many things from this. Just try to answer them. We'll have an interactive session. ये interactive session होगा. So you can answer those MCQs. Options देख लीजिए, and then why that is the answer and why that is not the answer. The other options. So everything gets covered in that. ठीक है बच्चों? चलो. So good evening to all of you once again and welcome to this FMGE Sprint series. We start with the first MCQ students. Initiation of arm is done by which muscle? Come on, you can answer this. You can answer this, then I'll explain. Initiation of abduction. What is the meaning of it? इसका मतलब क्या होता है? What is the meaning of initiation of abduction? That is the beginning of abduction. Yes, what is the answer? Any guesses? You can answer. Answer करिए. Even if it is wrong, that's okay, but always answer. Initiation of abduction, that is 0 to 15 degrees of abduction. 0 to 15 degrees of abduction is known as initiation of abduction. And this is done by whom? This is done by supraspinatus. 0 to 15 degrees of abduction, which we call as initiation of abduction. And this is done by supraspinatus. ठीक है students, 15 to 90 degrees of abduction, ये कौन करेगा? 15 to 90 degrees. Yes. Answer this. 15 to 90 degrees of abduction is done by deltoid. Deltoid. And 90 and above. 90 and above को क्या बोलते हैं? That is overhead abduction. Overhead abduction of arm. This is done by whom? This is done by serratus anterior, trapezius, and scapula. Lateral rotation of scapula. Okay, lateral rotation of scapula. So 0 to 15 degrees of abduction is done by supraspinatus. This is very important, bachcho. 15 to 90 degrees is done by deltoid, and 90 and above, this is called as overhead abduction. This is done by serratus anterior, trapezius, and the lateral rotation of scapula. Am I clear? Fine. Chalo. Students, can you tell me what is the nerve supply of trapezius? Dekho, baki sare MCQs also will cover in this. What is the nerve supply of trapezius? Yes, any guesses? That's a spinal accessory nerve. Trapezius is supplied by spinal accessory nerve. What is the nerve supply of deltoid? Yes, deltoid का nerve supply क्या होता है? Axillary nerve. Yes, axillary nerve. What is the nerve supply of serratus anterior? Serratus anterior is supplied by the long thoracic nerve. Long thoracic nerve. This is all you have to know. And supraspinatus, any guesses? Supraspinatus is supplied by whom? Yes, supraspinatus is supplied by the suprascapular nerve. Suprascapular nerve, which is a branch of upper trunk of the brachial plexus. Suprascapular nerve. Okay, fine. Perfect. Is this MCQ clear to all of you? Okay, fine. We'll proceed to the next MCQ. Once again, trapezius ka nerve supply, spinal accessory nerve, that's 11. Deltoid ka nerve supply, axillary nerve. Serratus anterior, it's the long thoracic nerve or the nerve bell. And supraspinatus ka nerve supplies suprascapular nerve, which arises from the upper trunk of the brachial plexus along with the nerve to subclavius. Nerve to subclavius. That's it. That's about the MCQ. Perfect. Yes. So we'll go to the next MCQ. कुछ डाउट्स है तो बोलिए. If you have any doubts, you can ask me. See this MCQ, numbers 2. A 40 years old male complains of tingling and numbness on the lateral aspect of the arm. Tingling and numbness on the lateral aspect of the arm. The nerve affected would be a branch of. Yes, what do you say? If I tell you a 40 years old male complains of tingling and numbness on the lateral aspect of forearm, अगर ये forearm होगा तो इसका आंसर क्या होगा? If it is forearm instead of arm, if the person is forearm, क्या आंसर हो सकता है? Who supplies the skin on the lateral aspect of the forearm? That's the musculocutaneous nerve. Musculocutaneous nerve, that is known as the lateral cutaneous nerve of forearm. Lateral cutaneous nerve forearm, that's a continuation of musculocutaneous nerve, and this nerve supplies the skin on the lateral aspect of the forearm. Now, who supplies the skin on the upper lateral aspect of the arm? Students, question क्या है? Who supplies the skin on the upper lateral aspect of the arm? Any guesses? Any guesses? Come on, students. You can answer this. Upper lateral aspect of the arm, the nerve is axillary nerve. Axillary nerve. Answer is axillary nerve. So, which is the nerve which supplies the skin on the upper lateral aspect of the arm? That's the axillary nerve. And this is what we call as the upper lateral cutaneous nerve of arm. Bachcho, that is known as the upper lateral cutaneous nerve of arm. An injury to this nerve would lead to, इसका नाम क्या है? Regimen batch sign. What is regimen batch sign? That's a loss of sensations of the skin on the upper lateral aspect of the arm. ठीक है बच्चों? Who supplies the skin on the upper lateral aspect of the arm? The answer is axillary nerve. Answer for this is axillary nerve. Fine. Radial nerve supplies the skin on the lower aspect, lower lateral aspect of the arm. Lower lateral aspect of the arm, that is supplied by radial nerve. Radial nerve. This is clear, students, to all of you. Chalo, can you tell me the root value of radial nerve? ये भी खत्म करते हैं. What is the root value of radial nerve? Root value of radial nerve is C5 to T1. ये सब MCQs में पूछते हैं. This all is asked in MCQs. What is the root value of radial nerve? It's C5 to T1. What is the root value of axillary nerve? Come on, बच्चों. Can you answer this? Root value of axillary nerve? Yes. Yes, Paras. Very good, Paras. Very good. What is the root value of axillary nerve? Yes, Farah. Shivam. Axillary nerve का root value is C5C6. C5C6. What is the root value of musculocutaneous nerve? Anyone? Musculocutaneous nerve is C5, C6, C7. ये root values याद रखना, students. This is very important. And what is the root value of ulnar nerve? C7, C8 and T1. C7, C8 and T1. So radial nerve is a continuation of the posterior cord. Bachcho, radial nerve is a continuation of posterior cord. Radial nerve का root value is C5 to T1. और कोई nerve है जिसका root value is C5 to T1? All the roots. एक radial nerve है which has got C5 to T1. Any other nerve? Yes, Jishan. Any other nerve which has root value C5 to T1? Come on. Any guesses? C5 to T1 is present in two nerves. एक है radial nerve, which is the other nerve. Other nerve is median nerve. Median nerve. Because median nerve कैसे बनती है? Median nerve is formed by two roots. One is the medial root of median nerve, the lateral root of median nerve. So median nerve का root value क्या होता है बच्चों? C5 to T1. Am I clear to all of you? Yes? Perfect. Perfect. Very good. Very good. So let us proceed to the next MCQ. Okay? Fine. Going to the next MCQ, students, have a look at this. The medial boundary of anatomical snuff box is formed by, yes, any guesses? Medial boundary of anatomical snuff box. एक slide draw करता. I'll just draw one slide. This is a very very important MCQ बच्चों. And anatomical snuff box पे हमेशा confusion होता है. There's always a confusion on this. Boundaries. Look how I make this slide. That's a radius, head of the radius. ये है neck of the radius. That's the shaft of the radius. Students, what's this? That's the styloid process of radius. That's the ulna here. That's the styloid process of ulna. Okay. Now, this is the dorsal aspect, posterior aspect. This is a muscle which begins from both radius and ulna. What is this muscle? इसका नाम है abductor pollicis longus. Abductor pollicis longus. This is a muscle which begins from the radius. इसका नाम है extensor pollicis brevis. Extensor pollicis brevis. Abductor pollicis longus, extensor pollicis brevis. They go together. They go together. What is this muscle? Students, this is the extensor pollicis longus. And this extensor pollicis longus goes alone. Alone. ये बन गया snuff box. Students, this is the snuff box. So which is this boundary of the snuff box? That's the lateral boundary. And which is this boundary of the snuff box? That's the medial boundary. बस ये slide याद रखना. Everything is going to be clear. So the lateral boundary of the snuff box would be formed by abductor pollicis longus and extensor pollicis brevis. Perfect. The medial boundary would be formed by extensor pollicis longus. Extensor pollicis longus. The floor of the snuff box would be formed by what? The styloid process and the bones of the scaphoid and trapezium. Scaphoid and trapezium. The floor is formed by the scaphoid and trapezium bone and the styloid process of radius. Excellent. Very good to all of you students. Am I clear? ये देखिए अब and see this slide. This is a beautiful slide है ना. ये आ सकता है visuals में. So be very clear. So have a look at this. What is this tendon of? This is the abductor pollicis longus. ये है extensor pollicis brevis and this is the extensor pollicis longus. ये है snuff box. So this is going to form the lateral boundary and this is going to form the medial boundary of the snuff box. Perfect. The extensor carpi radialis longus and brevis are in the floor. S. Floor में styloid process है, scaphoid है, trapezium है. Floor is also having ECRL and ECRB. The extensor carpi radialis longus and brevis के tendons होता है floor में. Very good students. Come on. So what is the answer for this? Yes, Gaurav. Extensor pollicis longus. Very good. Yes, Paras. Very nice. S. You are also right. Jishan. Mohammed Hadis. Farah. Very good. All of you. Chalo. Ye clear hai? Is this clear to all of you? Anatomical snuff box. Visual slide bhi important hai. MCQ bhi important hai iska. Perfect. We proceed to the next MCQ, students. Answer this. Claw hand is due to involvement of which of the following nerve? An easy MCQ. Chalo, answer kariye. Easy MCQ. Claw hand is due to involvement of? Yes. Just tell me which muscle when paralyzed leads to claw hand. Which is that muscle? Jab paralyzed hoga, it leads to claw hand. The name of the muscle is lumbrical. Lumbrical muscle, right? So lumbrical muscle, yes, lumbrical muscles कितने होते हैं? 4 होते हैं. There are 4 lumbrical muscles. 4 lumbrical, the first, the second, the third and the fourth lumbrical. So paralysis of lumbricals leads to claw hand. Bachcho, the first and the second lumbrical is supplied by which nerve? Median nerve. And the third and the fourth lumbrical is supplied by ulnar nerve. So now tell me students, if the median nerve is injured, how many lumbricals are paralyzed? The first 2 lumbricals are paralyzed. You get a claw hand of the first and of the index finger and the middle finger. अगर ulnar nerve की इंजरी होती है then the third and the fourth lumbricals are paralyzed. You get a claw hand of ring finger and little finger. This is known as partial claw hand, है ना, ये partial claw hand, इसे हम बोलेंगे ulnar claw hand, and this is what we call as a median claw hand. If the median nerve is paralyzed, ये ऐसे होगा. If the ulnar nerve is paralyzed, ये ऐसे होगा. This is what we call as partial claw hand. But बच्चों, if both median and ulnar nerve are damaged, then all the lumbricals are paralyzed. This is what we call as a complete claw hand. So a claw hand is due to involvement of which of the following nerve? Median nerve as well as ulnar nerve. So your answer is both. Understanding now? इसे हम बोलेंगे complete claw hand. Complete claw hand. Yes, very good, very good. Come on. So coming to the next MCQ. See, these are the lumbricals. That's a first lumbrical. Okay, let me just draw this. Yes, that's a first lumbrical. That's a second lumbrical. That's a fourth, third, and fourth lumbrical. And what is this tendon? What is this tendon? जहाँ से ये lumbricals arise होते हैं? Flexor digitorum profundus. Flexor digitorum profundus. Okay, perfect. Very good. Students, see the next MCQ. The boundaries of femoral ring includes all the following except. Yes, answer this. पहले answer करिए. What is the answer for this? The boundaries of femoral ring includes all the following except. The answer is femoral artery. Femoral artery. So inguinal ligament is also known as what? Oppart's ligament. And what is this form? The anterior boundary. Anterior boundary is formed by inguinal ligament. Lacunar ligament is also known as Gimbernet's ligament. ये सब याद रखना बच्चों. These are all very important MCQ. Gimbernet's ligament. ये क्या boundary बनाएगा? Medial boundary. Medial. Pectinate ligament is also known as Cooper's ligament. Cooper's ligament. And what boundary is this going to form? The posterior boundary. Posterior boundary. अब बचा क्या है बच्चों? What is left? The lateral boundary. And the lateral boundary is formed by, yes, any guesses? Septum separating it from femoral vein. Femoral vein. Artery नहीं होती है बच्चों. Artery नहीं होती है. It's the vein which is there in the lateral boundary, right? So the answer here is femoral artery. Are you getting this, students? Are you able to follow this? So inguinal ligament forms the anterior boundary. Medial is formed by the lacunar ligament. Posteriorly is the pectinate ligament. And laterally is the septum separating it from femoral vein. For a S, Gaurav, answer is C, बच्चों. C, not D. D नहीं answer उसका, C है. देखिए, this is the femoral ring. ये femoral ring है. देखिए, that's a femoral ring. So what is this boundary? That's the anterior boundary. That's a medial boundary. That's the posterior boundary. And what is this boundary? ये है lateral boundary. So laterally कौन है? Femoral vein होता है बच्चों. Artery नहीं होती है. Femoral vein होता है. ठीक है? And what is this? This femoral ring is closed by a lymph node, है ना? यहाँ पे एक lymph node होता है. And what is this lymph node known as? The lymph node of Cloquet. The lymph node of Cloquet or Rosenmuller. Lymph node of Cloquet or Rosenmuller. And what is this lymph node drain? It drains the glans penis and the glans clitoris. The glans penis and the glans clitoris. That is drained by the lymph node of Cloquet. Perfect. Is this clear to all of you? Okay, fine. We proceed to the next MCQ. Yes, students, that's a visual slide for you. Bachcho, can you identify this pointed structure? Yes, that's a muscle here. Any guesses? And that's the longest muscle in the body. The longest muscle in the body. Any guesses? This muscle is also known as Taylor's muscle. Abhi boliye. What is the name for this? A very important visual slide for you, students. And this is the sartorius. है ना? ये sartorius है. So what is the origin of sartorius? It's the anterior superior iliac spine. And where is the insertion of sartorius? It's inserted on the tibia. Tibia. Sartorius is also known as the Taylor's muscle. Taylor's muscle. Okay, so just be clear about this. That's a sartorius. Okay, fine. ये sartorius है. Okay, डॉक्टर दीपा, ठीक है. ये मसल का नाम है sartorius. ओरिजिन कहाँ है उसका? एंटीरियर सुपीरियर इलियक स्पाइन. एंड उसका इंसर्शन कहाँ पे होता है? द इंसर्शन इज ऑन द टिबिया. बच्चों, sartorius is also known as Taylor's muscle. Perfect, perfect. Okay, Dr. Deepa, fine now. Okay, चलो, good to all of you. Good. ये आंसर करिए आप. Obturator nerve supplies one of the following muscle. चलो, can you answer this? बच्चों, आंसर करिए. Obturator nerve supplies one of the following muscles. What do you say? Obturator nerve कौन से कंपार्टमेंट को सप्लाई करती है? Which compartment of the thigh does the obturator nerve supply? Yes, the medial compartment. Correct, correct. It supplies the medial compartment of the thigh. अभी बताइए. Yes, very good. Gaurav, very good, very good. The answer is adductor brevis. Adductor brevis. Adductor brevis is supplied by the obturator nerve. Very good. Excellent. बच्चों, gluteus medius का nerve supply बोल सकते हो? Come on, be quick. Come on, answer. Come on. It's a rapid revision for you, bachcho. You know all these things. It's a quick revision for you. Gluteus medius का nerve supply कोई बोल सकता है? Gluteus medius का nerve supply. It's the superior. Anji, gluteal nerve. Very good, बच्चा. It's the superior gluteal nerve. Obturator internus का nerve supply बोल सकते हो? Obturator internus इसे कौन supply करता है? That's a nerve to obturator internus. Nerve to obturator. And sartorius का nerve supply क्या है? Femoral nerve. Femoral nerve. Be very clear about the nerve supply, बच्चा. This is very important. चलो, very good, very good. गौरव, तो superior gluteal nerve क्या मसल सप्लाई करते हैं? ये बोल सकते हो superior gluteal nerve 3 मसल सप्लाई करते हैं. बोल सकते हैं? Superior gluteal nerve supplies gluteus medius, gluteus minimus, and which is the third muscle? बच्चों, which is the third muscle? Anyone? Superior gluteal nerve 3 मसल सप्लाई करती है. एक है gluteus medius, एक है gluteus minimus. Which is the third muscle? That is what I'm asking you. You guess करिए, चलेगा. It's okay, you can guess this. तीसरा मसल, ये बहुत इंपॉर्टेंट एमसीक्यू है बच्चों. The superior gluteal nerve supplies gluteus medius, minimus, and okay, I'll tell you, tensor fascia lata. Tensor fascia lata. ठीक है, ये याद रखना बच्चों. This is very important. I hope you're all following this. नहीं, maximus नहीं बच्चा, maximus नहीं, pyriformis नहीं. No. Maximus is supplied by inferior gluteal nerve. ये याद रखना. This is very important. Gluteus maximus, दीक्षांत, gluteus maximus का nerve supply क्या है? Inferior gluteal nerve. And gluteus medius, minimus and tensor fascia lata का nerve supply क्या होता है? Superior gluteal nerve. I hope this is clear to you. Very clear? Yes? Fine. Proceeding. Students, we go to the next MCQ here. Here, during dissection, a student identifies the hunters or the subsartorial canal below the apex of the femoral triangle. ये correct है? जहाँ पे where the femoral triangle ends, what begins is the hunter's canal or the subsartorial canal. It contains all the following structures except, yes. So what are the contents of adductor canal? Adductor canal, also known as the subsartorial canal. Femoral artery, yes. Femoral vein भी होता है उसके साथ. Saphenous nerve, yes. The posterior division of obturator nerve, yes. So who's not there? The nerve to vastus lateralis नहीं होता है hunter's canal में बच्चों. हाँ, it is nerve to vastus medialis. It's nerve to vastus medialis. बच्चों, nerve to vastus lateralis is wrong. So subsartorial canal में nerve to vastus lateralis नहीं होता बच्चों. It is a nerve to vastus medialis. Am I clear? So femoral artery होती है, yes, femoral vein होता है, saphenous nerve भी होती है, and the posterior division of obturator nerve along with the nerve to vastus medialis. I hope I'm clear. Have a look at this. ये है adductor canal. That's the adductor canal. So ये है femoral artery, ये है femoral vein. That's the saphenous nerve. ये femoral artery हो गई, ये femoral vein हो गया. That's the saphenous nerve, and this is the nerve to vastus medialis. Nerve to vastus medialis. Perfect. Okay, let us proceed to the next MCQ. Okay, बच्चों, can you identify this muscle? ये बहुत इंपॉर्टेंट विजुअल स्लाइड है बच्चों. इट्स अ वेरी इंपॉर्टेंट विजुअल स्लाइड. come on students, can you answer this MCQ? Identify the pointed structure. अभी किसी ने लिखा था इसका नाम. Someone had written the name in this while answering an MCQ. It's a pear shaped muscle. क्या बोलते हो? It's a pear shaped muscle. Any guesses? Yes? लिखो लिखो, I'm looking at the screen. लिखिए आप. It's a pear shaped muscle. आंसर करिए. Come on students. Piriformis. Excellent Dikshant. It's piriformis. And this piriformis is known as the key muscle of the gluteal region. बच्चों piriformis is known as the key muscle of the gluteal region because सारी structures are concentrated around the piriformis. There are structures around the piriformis. Very good all of you बच्चों, very good. चलो ये आंसर कर सकता है कोई? What is this nerve? ये देखिए, that's the superior gluteal nerve. ये होगा inferior gluteal nerve. What is this nerve? Can anyone tell me what is this nerve? That's the sciatic nerve. Okay, what is this nerve? ये कौन है? ये एक बार MCQ आ चुका है. This is the pudendal nerve. ये है pudendal nerve. A very important structure, pudendal nerve. Perfect. चलो, we go to the next MCQ, students. Answer this. Which of the following structures pass through the greater sciatic foramen? Yes. Answer this. This is easy. Easy idea. Out of all the structures, which is the structure which passes through the greater sciatic foramen? That's the superior gluteal nerve and vessels. Superior gluteal nerve and vessels pass through the greater sciatic foramen. Tendon of obturator internus passes through lesser sciatic foramen. Obturator internus goes through the lesser sciatic foramen. Yes. Fine. Semimembranosus tendon कहाँ होता है? It's in the posterior compartment of the thigh, है ना? Semimembranosus is in the posterior compartment of the thigh. Anterior cutaneous nerve of the thigh. This is a branch of femoral nerve. ये किसकी branch है? Femoral nerve. It's a branch of femoral nerve. So what passes through the greater sciatic foramen? Superior gluteal nerve and vessels. I'll just enumerate the structure. दूसरा है inferior gluteal nerves and vessels, the piriformis, the sciatic nerve, the posterior cutaneous nerve of thigh, the pudendal nerve, the internal pudendal vessels, the nerve to obturator internus, and the nerve to quadratus femoris. The nerve to quadratus femoris. बस ये याद रखना है आपको. These are the structures which go out through the greater sciatic foramen. Okay, students, perfect. What is this foramen? ये देखिए, what is this foramen? That's the greater sciatic foramen. And ये क्या होता है? Lesser sciatic foramen. That's a lesser sciatic foramen. Okay. And what is this? What structure passes through this? The obturator nerve and vessels. The obturator nerve and vessels passes through this foramen. Fine. Come on students, can you answer this MCQ? The glans penis drains into which of the following lymph nodes? I just told you. I just told you this. The glans penis and the glans clitoris, it drains into the lymph node of Cloquet. And ये जो lymph node of Cloquet है, that's a deep inguinal lymph node. That's a deep inguinal lymph node. That's a lymph node of Cloquet or Rosenmuller. It's the lymph node of Cloquet or Rosenmuller. So the glans penis and the glans clitoris drains into the lymph node of Cloquet or Rosenmuller. The penis and the clitoris drains into the superficial inguinal lymph nodes. The entire penis and clitoris अगर MCQ आता है तो ये कहाँ पे drain होगा? Superficial inguinal. But the glans penis and the glans clitoris drains into the deep inguinal lymph node. That's the lymph node of Cloquet. Para-aortic lymph node what drains? बच्चों क्या बोल सकते हो? Para-aortic lymph nodes क्या drain करता है? That's a testis and ovary, है ना? Testis and ovary that drains into the para-aortic lymph nodes. And internal iliac lymph nodes में the pelvic organs, है ना? Pelvic organs, the uterus, the bladder, the rectum, ये सब drain करता है internal iliac lymph nodes में, the pelvic organs. Perfect है बच्चा? Is this clear to all of you students? Very good, very good. Let us proceed. Yes. A 33-year-old patient is suffering from sudden occlusion at the origin of descending thoracic aorta. This condition would most likely decrease blood flow in which of the following intercostal arteries? Yes, any guesses? So there's an obstruction to the aorta, bachcho. So which arteries would be blocked? That is the lower 6 posterior intercostal. Lower 6 posterior intercostal. The upper two posterior intercostal arteries are branches of ये aorta की branch नहीं है. The upper two posterior intercostal arteries are not branches of the descending thoracic aorta. 2 के नीचे the lower intercostal arteries are branches of descending thoracic aorta. Okay. So upper two posterior intercostal arteries are branches of the superior, these are the branches of superior intercostal artery, which is a branch of costo-cervical trunk, which is a branch of second part of subclavian artery. Subclavian artery. मतलब बच्चों, in the upper two intercostal spaces, in the upper two posterior intercostal spaces, इसे कौन supply करता है? This is supplied by subclavian artery. ये subclavian artery supply करते हैं. The upper two posterior intercostal spaces are supplied by posterior intercostal arteries. The descending thoracic aorta supplies the lower intercostal spaces. तो अगर descending thoracic aorta block होगा, so blood flow will be stopped in which? The lower 6 posterior intercostal arteries. ठीक है, this is clear. Fine. So the answer is D for this. D. Okay, I'll proceed to the next MCQ. चलो बच्चों ये आंसर करिए. This is a easy MCQ. Extent of the lung in the mid axillary line is. Can anyone answer this? So I'll just write this down for you. Mid clavicular, mid axillary, and mid scapular. चलो आंसर करिए. Mid clavicular, mid axillary, and mid scapular line. What is the extent of lung and what is the extent of pleura? Yes, bachcho, come on. Can you answer this? What is the extent of lung in the mid clavicular line? 6th rib, 8th rib, 10th rib. 6, 8, 10. And what is the extent of pleura? 8, 10, and 12. So extent of lung in the mid axillary line is, yes, 8th rib. Excellent. Very good, Gaurav. Very good, Farah. Very nice. Very good. That's a very important MCQ too. ये याद रखना. चलो perfect. Very nice. आपको ये पता है. प्लूरा के टाइप्स बोल सकते हो. प्लूरा के टाइप्स एक है विसरल प्लूरा, दूसरा होता है पैराइटल प्लूरा. अब पैराइटल प्लूरा के टाइप्स बोल सकते हो बिकॉज इसका नर्व सप्लाई बहुत इंपॉर्टेंट है. व्हाट आर द टाइप्स ऑफ पैराइटल प्लूरा? द कॉस्टल प्लूरा, द सर्वाइकल प्लूरा, द डायफ्रैग्मेटिक प्लूरा एंड क्या बाकी है? कॉस्टल, सर्वाइकल, डायफ्रैग्मेटिक एंड मीडियास्टिनल प्लूरा. मीडियास्टिनल नर्व सप्लाई बोल सकते हो बच्चों. नर्व सप्लाई द कॉस्टल प्लूरा एंड द सर्वाइकल प्लूरा. कॉस्टल एंड सर्वाइकल प्लूरा इसका नर्व सप्लाई बोल सकते हो. एंड द डायफ्रैग्मेटिक एंड मीडियास्टिनल प्लूरा इसका नर्व सप्लाई बोल सकते हो. कम ऑन बच्चों, कैन यू आंसर दिस? इट्स अ वेरी इंपॉर्टेंट एमसीक्यू. कॉस्टल प्लूरा एंड सर्वाइकल प्लूरा का नर्व सप्लाई कौन है? इंटरकॉस्टल नर्व्स. ये है इंटरकॉस्टल नर्व्स. And the diaphragmatic and the mediastinal pleura is supplied by, yes, any guesses? The phrenic nerve. Phrenic nerve. ऐसे डिस्कस करेंगे ना तो डिस्कशन इज नेवर गोइंग टू स्टॉप. यस, दैट्स अ phrenic nerve. Costal pleura, cervical pleura, intercostal nerve, and diaphragmatic and mediastinal pleura. That's a phrenic nerve. Root value of phrenic nerve बोल सकते हो C3, C4, C5. Another very very important MCQ बच्चों. C3, C4, C5. That's the root value of phrenic nerve. Okay. We'll proceed to the next MCQ. MCQs बहुत है. That is why I'm going like that. This is for FMGE exam which is coming now. It's an FMGE revision. Dr. Surya. It's a quick revision for FMG, but you can also attend this because questions are very important. You can also answer, in fact. Come on, students. The posterior interventricular artery is a branch of. Any guesses? क्या बोलते हो? Posterior intercostal artery is a branch of. Any guesses? Posterior interventricular artery is a branch of, yes, it is actually a branch of right coronary artery. In 85% of the cases, this is a branch of right coronary artery, and this is what we call as the right coronary dominance. Right coronary dominance. Yes, very good, Dikshant. तो अगर ये पोस्टीरियर इंटरवेंट्रिकुलर आर्टरी, इफ इट इज अ ब्रांच ऑफ राइट कोरोनरी, अपन इसे बोलेंगे राइट कोरोनरी डोमिनेंस. इफ दिस पोस्टीरियर इंटरवेंट्रिकुलर आर्टरी इज अ ब्रांच ऑफ लेफ्ट कोरोनरी, क्या बोलोगे? इट्स द लेफ्ट कोरोनरी डोमिनेंस. मतलब ये कार्डियक डोमिनेंस कौन डिटरमाइन करता है? हु डिटरमाइंस दिस कार्डियक डोमिनेंस बच्चों? द पोस्टीरियर इंटरवेंट्रिकुलर आर्टरी. Yes, posterior interventricular artery determines the cardiac dominance. बस ये याद रखना. Anterior interventricular artery is a branch of left coronary artery, है ना? Anterior interventricular artery is a branch of left coronary. दूसरी branch left coronary artery की circumflex. The second branch is circumflex. मतलब left coronary artery के दो branches होते हैं. एक है anterior interventricular artery and दूसरी है circumflex. Okay. Fine. Is this clear? We go to the next MCQ. बच्चों, next MCQ. See this. This is the posterior interventricular artery. ये है posterior interventricular artery. This is the anterior interventricular artery. This is the circumflex. This is the right coronary artery. Okay. ये circumflex नहीं है, ये right coronary है. This is the right coronary artery. उसका branch है posterior interventricular artery, and this is the circumflex. That's a circumflex branch. Circumflex is a branch of left coronary. Perfect. Okay. Chalo students, coming to the next MCQ. Identify this impression. What is this impression for? It's the mediastinal surface of the right lung. अब बोलो. It's the mediastinal surface of the right lung, and ये किसका impression होगा? Any guesses? Come on, come on, come on, students. Come on, I'm waiting. Huh? Any guesses? बोल सकते हो? This is the mediastinal surface of the right lung. What is this chamber? यहाँ पे कौन सा chamber होगा ये? This is the right atrium. अभी बोलिए. Now you answer this. What is that impression for? That big vein, bacha. That is the big vein which opens into the right atrium. What is that? That's the impression for SBC. ये SBC का impression है. अगर ये SBC का impression है, what is this impression for? What is that structure which arches over the hilum of the right lung? बोल सकते हो? What is that structure which arches over the hilum of right lung? That's the azygous vein. Azygous vein. So the structure which arches over the hilum of right lung is azygous vein, and this azygous vein opens into SVC. तो ये किसका impression होगा बच्चों? SVC. And which is the structure which arches over the hilum of left lung? Yes, that's the arch of aorta. Yes, very good. That's the arch of aorta. Very good, very good. Students, coming to this MCQ. Terminal part of SVC is derived from one of the following veins. Any guesses? Terminal part of the SVC is derived from one of the following veins. Yes, any guesses? Terminal part of the SVC is derived from one of the following veins. एक मिनट, let me just draw this for you. ये embryology है veins का. What are these veins बच्चों? What is this veins that we have drawn here? ये है anterior cardinal vein. हाँ, ये है anterior cardinal. ये होगा posterior cardinal. हाँ, anterior cardinal, and ये कौन है? Common cardinal vein. Common cardinal vein. ओके बच्चों, वन मोमेंट है, एक मिनट, आई फिनिश दिस. यहाँ पे एक एनास्टोमोसिस होता है, यहाँ पे एक एनास्टोमोसिस होता है. There's a vein which comes and joins this anterior cardinal vein. इसका नाम क्या है? Subclavian vein. ये होगा subclavian vein. Okay, so now you tell me, what is this vein going to form? The part of the anterior cardinal vein above the attachment of subclavian vein. ये क्या बनेगा? Internal jugular vein. ये बनेगा internal jugular vein. This part of the anterior cardinal vein below the attachment of subclavian. ये क्या बनेगा? That's the right brachiocephalic vein. Right brachiocephalic. ये क्या बनेगा? This vein would become what? That's the left brachiocephalic. ये बनेगा left brachiocephalic vein. Now students, what is this going to form? What is this going to form? This is going to form the SVC. SVC. So SVC is derived from the right anterior cardinal vein. Okay, right anterior cardinal vein. And the terminal part, बच्चों देखो, ये terminal part of SVC is derived from what? ये कौन है? The terminal part of SVC, wait, I'll tell you. Neeraj, wait, don't get confused. The terminal part of SVC is derived from, ये है right common cardinal vein. Right common cardinal vein. मतलब SVC बच्चों, SVC is derived from two sources. नीरज देखो, SVC दो sources से बनता है. एक जो पार्ट है SVC का, that will be derived from the right anterior cardinal vein, and the terminal part of SVC is derived from the right common cardinal vein. यह है right common cardinal. इसका आंसर होगा right common cardinal vein. बच्चों, नीरज क्लियर है? नीरज बच्चा क्लियर है? So the terminal part of SVC is derived from the right common cardinal vein. The SVC is also derived from the right anterior cardinal vein below the attachment of anastomosis. Clear है कि नहीं? Students, ये clear है कि नहीं? Yes, Hemant has answered it. Yes. बच्चों बोलो, clear है? तो MCQ क्या है? Terminal part of SVC is derived from. So आंसर क्या होगा इसका? Right common cardinal vein. ठीक है नीरज? If it's not clear, you let me know. Okay, we go to the next MCQ. Okay, chalo answer this. Diaphragm is a muscular structure separating the thoracic from the abdominal cavities. One of the following structures passes through the IVC opening of the diaphragm. चलो बच्चों बोल सकते हो. One of the following structure passes through the IVC opening of the diaphragm. Any guesses? So IVC कैसे याद रखते हैं इसको? T8, T10, T12. T8 से कौन जाता है? IVC and बोलो right phrenic nerve. IVC and right phrenic nerve. T10 से कौन जाता है? Esophagus with vagus. And T12 से कौन जाता है? Aorta, azygous vein and thoracic duct. Aorta, azygous vein and thoracic duct. Am I clear, bachcho? So what is the answer for this? Diaphragm is a muscular structure separating the thoracic and the abdominal cavities. One of the following structure passes through the IVC opening of the diaphragm. Your answer is right phrenic nerve. Right phrenic nerve. ये बहुत बहुत इंपॉर्टेंट एमसीक्यू है बच्चों, याद रखना. What passes through T8 level through the diaphragm? IVC and right phrenic. T10 is esophagus with the right and left vagus. T12 is aorta, the azygous vein, and the thoracic duct. I hope I'm clear to all of you. Fine? Perfect. We proceed. Come on, bachcho, can you answer this? The following statements are true about the portal vein, except... Where is the portal vein formed? Can anyone answer this? देखिए, if I draw this as the pancreas, that's a head, neck, uncinate process, body and tail of the pancreas. ये क्या vein होता है? What is this vein which comes from behind the body of the pancreas? What is this vein? That's a splenic vein. Splenic vein. And what is this vein? That's the superior. Okay, Dr. Deepa, ये कौन है? Superior mesenteric vein. बच्चा, Dr. Deepa, that's a superior mesenteric vein. ये superior mesenteric vein कहाँ होता है? It's on the uncinate process, है ना? ये uncinate process के ऊपर है. अब ये गया uncinate process के पीछे. That's the superior mesenteric vein. ये आ गई अपनी splenic vein. अब ये क्या बना? What is this, बच्चा? That's the portal vein. So where is the portal vein formed? Behind the neck of the pancreas. है ना बच्चों? Portal vein कहाँ पे बनता है? Behind the neck of the pancreas. अब ये बोल सकते हो बच्चों, ये कौन ड्रॉ किया मैंने? What is this? ये है duodenum. ये अपना duodenum बन गया. This is the first part of the duodenum. ये है second part. ये कौन है? Third part of the duodenum. So ये जो portal vein है बच्चा, it passes behind which part of the duodenum? देखो, this portal vein is going behind the first part of the duodenum, है ना? ये first part of duodenum के पीछे से जाएगा. And then it is going to what? It will go to the liver. ये liver की तरफ जाएगा, है ना? Sorry, the portal vein will go to the liver. अब जब ये liver में जाएगा, it is enclosed in what? Lesser omentum. यहाँ पे क्या होता है? Lesser omentum. है ना? So portal vein कहाँ पे बनती है? It is formed behind the neck of the pancreas. बराबर? The portal vein goes behind which part of the duodenum? First part. Second part के पीछे से नहीं जाती है. It goes behind the first part of the duodenum. So answer is B for this. It lies in the lesser omentum. ये है lesser omentum. And there's a vein which comes from the gallbladder. उसका नाम क्या है? Cystic vein. And this cystic vein drains into what? Portal vein. ये जो cystic vein है ना, it opens into the portal vein. हाँ, तो portal vein के और भी tributaries है बच्चा. एक है left gastric vein, एक होती है right gastric vein, एक होता है short gastric veins, right? Then the superior pancreaticoduodenal vein, cystic vein, and the para-umbilical veins. ठीक है? Okay, fine. डॉक्टर दीपा क्लियर है? फाइन. गौरव, शंभू, सुचमन, पारस, फरहा, वेरी गुड. तो इसका आंसर क्या होगा? एसेंस बिहाइंड द सेकेंड पार्ट ऑफ duodenum. वो रॉन्ग है. इट एसेंस बिहाइंड द फर्स्ट पार्ट ऑफ duodenum. ओके, दैट्स ग्रेट. फाइन, दैट्स ओके. आंसर दिस, all the following are contents of spermatic cord except, चलो बच्चों ये आंसर करिए, this is an easy MCQ, क्या आंसर करिए, spermatic cord के contents all the following except, yes, क्या बोल रहे हो, yes, the answer is ilioinguinal nerve, very good, answer is ilioinguinal nerve. इलियोइंक्वाइनल नर्व बच्चा स्पर्मेटिक कॉर्ड के अंदर नहीं होता, इलियोइंक्वाइनल नर्व इज इनसाइड द इंक्वाइनल कैनाल, बट ये स्पर्मेटिक कॉर्ड के बाहर होता है, राइट, it's thank you sir, thank you, it's inside the inguinal canal, but it's outside the spermatic cord, correct है बच्चा. So which is the nerve which is inside the spermatic cord, कोई बोल सकता है, nerve which is inside the spermatic cord, yes. तो spermatic cord के contents बोलिए, एक है vas deferens, yes, then the testicular artery, the artery to the vas, the pampiniform plexus of veins, और क्या होता है, the genital branch of genitofemoral nerve. So which is the nerve within the spermatic cord, it's not ilioinguinal, ये होता है genital branch of genitofemoral nerve and the lymphatics from the testis, ठीक है. So answer is ilioinguinal nerve, ये आपको पता होगा. चलो we'll go to the next MCQ बच्चों. Come on students, if you can answer this MCQ, a very important MCQ, come on. The following peritoneal ligaments are derived wholly or partially from the dorsal mesogastrium except, ये embryological MCQ है. हाँ, yes, very good Dikshant, very good. The answer for this guess कर सकते हो. तो ये देखिए, ये अपना stomach है, that's the stomach here. ये कौन है, ये that's the ventral mesogastrium, and ये कौन होता है, ये पीछे ये होता है dorsal mesogastrium, है ना, ये ventral mesogastrium, ये dorsal mesogastrium. So what develops from the ventral mesogastrium, ये है falciform ligament, ये याद रखना बच्चों, falciform ligament, ये है lesser omentum, और क्या डेवलप होता है वेंट्रल मीसोगैस्ट्रम में, दैट इज द सुपीरियर एंड इंफीरियर लेयर्स ऑफ कोरोनरी लिगामेंट, द सुपीरियर एंड इंफीरियर लेयर्स ऑफ कोरोनरी लिगामेंट एंड द राइट एंड द लेफ्ट triangular ligaments, these are derived from ventral mesogastrium. Once again, the falciform ligament, the lesser omentum, the superior and inferior layers of coronary ligament, the right and the left triangular ligaments, these are derived from ventral mesogastrium. What is derived from the dorsal mesogastrium बच्चों, a very important MCQ. अब ये क्या होगा, from the stomach to the spleen, that's the gastrosplenic ligament, हाँ gastrosplenic ligament. Spleen to the kidney, ये क्या होगा, lienorenal ligament. Third is greater omentum, and the gastrophrenic ligament. चार things है, gastrosplenic, lienorenal, the gastrophrenic ligament, and the greater omentum. This is derived from dorsal mesogastrium. Chalo, answer this now. The following peritoneal ligaments are derived wholly or partially from the dorsal mesogastrium except the lesser omentum. Lesser omentum is derived from ventral mesogastrium. Ventral mesogastrium से derived होता है. Fine. Okay, that's it. बच्चों ये आइडेंटिफाई कर सकते हो, ये पॉइंटेड स्ट्रक्चर आइडेंटिफाई कर सकते हो. कम ऑन, अ वेरी वेरी इंपॉर्टेंट एमसीक्यू स्टूडेंट्स. ये पॉइंटेड स्ट्रक्चर क्या है? यस दीक्षांत, कम ऑन गौरव, फरहान, यस पारस, डॉक्टर दीपा, चंबू, सुषमन, हेमंत इज नॉट आंसरिंग. नीरज, आंसर करिए बच्चों. व्हाट इज दिस? पॉइंटर इनटू, वो एक फोरामेन है बच्चा, फोरामेन. ये फोरामेन के अंदर में जाऊं, इफ आई एंटर इनटू दिस फोरामेन, आई गो इनटू द लेसर सैक. कम ऑन, कैन यू आइडेंटिफाई दिस फोरामेन? एपिप्लॉइड फोरामेन. एक्सीलेंट, वेरी गुड बच्चा. ये बहुत इंपॉर्टेंट विजुअल स्लाइड है आपके लिए. दैट्स द एपिप्लॉइड फोरामेन. यस, वेरी गुड. हाँ, ये एकदम स्पॉट विजुअल था. ये लेसर मोमेंटम है, ये ग्रेटर मोमेंटम है. यस, वेरी गुड. सबने आइडेंटिफाई किया. चलो, answer coming to the next MCQ. A 27-year-old primary gravida had visited your clinic for her routine pregnancy checkup, and as a part of consultation, you explain her the do's and don'ts of during pregnancy. During embryological development of the baby, which of the following structures remain unfused and form the labia minora in fetus? चलो बोलिए. या ना अपन इधर ऐसे लिखते हैं मेल एंड फीमेल. Phallus. What is this phallus form? In males, it forms the penis. This is an important MCQ. In females, it forms the clitoris. Phallus. Labioscrotal swelling. ये क्या बनाएगा? Scrotum in males and labia majora in females. Urogenital fold से क्या बनेगा? In females, labia minora in females, and in males what does it form? It forms the ventral aspect of the penis. Ventral aspect of the penis. Urogenital folds. Males में क्या बनाता है? Ventral aspect of penis. Females में ये बनाएगा labia minora. Labioscrotal swellings. In male it forms the scrotum. In females it forms the labia majora, and the phallus, or this is also known as the genital tubercle. Genital tubercle. In males it forms a penis. In females it forms a clitoris. Fine. Sinovaginal bulb. What is this form? It forms a lower. Bacha, this is very important. A sinovaginal bulb forms the lower 2/3 of the vagina. Lower 2/3 of the vagina. And the upper 1/3 of the vagina is derived from, yes, बोल सकते हो, paramesonephric duct. Upper 1/3 of the vagina is derived from the paramesonephric ducts. The lower 2/3 of the vagina is derived from the sinovaginal bulbs. ये याद रखना बच्चों, this is very important. So what is the answer for this? Labia minora ना, तो answer is urogenital folds. Labia minora. This is very important. ठीक है, I hope this is clear to all of you बच्चा. ये देखिए, see this is the phallus. This is the labiocrotal swellings, and this is the urogenital folds. Okay, fine, perfect. Chalo, coming to the next MCQ. Come on students, come on, can you answer this? A 35 years old female comes to the OPD. Her newborn child complains of vomiting after feeding. Obstruction to the small intestines was thought of. An MRI scan revealed a mass around the second part of duodenum and the narrowing of lumen. A diagnosis of annular pancreas was made. All the following are derived from the dorsal pancreatic bud except. Any guesses? डॉर्सल एंड वेंट्रल पैंक्रेटिक बड. चलो बोल सकते हो आप. एक है डॉर्सल पैंक्रेटिक बड एंड एक है वेंट्रल पैंक्रेटिक बड. डॉर्सल से क्या बढ़ता है? हेड, नेक, बॉडी एंड टेल ऑफ द पैंक्रियास. हेड का अपर पार्ट, हाँ ये याद रखना. अपर पार्ट ऑफ द हेड, नेक, बॉडी एंड टेल इज डिराइव्ड फ्रॉम द डॉर्सल पैंक्रेटिक बड. वेंट्रल से क्या बनता है? वेंट्रल से बनता है लोअर पार्ट ऑफ द हेड, lower part of the head and uncinate process. Lower part of the head and the uncinate process. Yes, very good. So the answer is uncinate process. Excellent, Gaurav. Very good. So this you should know, bacha. This is extremely important. देखो, the dorsal pancreatic bud से क्या बनता है? The upper part of the head, neck, body and tail of the pancreas. And the ventral bud से बनेगा the lower part of the head and the uncinate process. Okay. If the ventral bud does not migrate properly, what happens? Annular pancreas. Annular pancreas is due to defective migration of the ventral pancreatic bud. And non-fusion of these two buds results in pancreatic division. Pancreatic division. Perfect. Okay. चलो बच्चों, answer this. Come on, coming to the head and neck MCQs. Which of the following is not a branch of posterior division of mandibular nerve? ये बोल सकते हो? Posterior division of mandibular nerve. A very important MCQ, बच्चों, very important MCQ. Answer is deep temporal nerve. Deep temporal nerve is a branch of anterior division. Anterior division of mandibular nerve. So posterior division of mandibular nerve के 3 branches है, lingual, inferior alveolar and auriculotemporal. And anterior division gives, I'll just make it, anterior division of mandibular nerve gives 3 motor branch and 1 sensory branch. 3 motor, 1 sensory. Sensory is known as buccal nerve. Buccal nerve. Motor branches will supply the muscles of mastication. What is that? Masseteric nerve, deep temporal nerve, and nerve 2, lateral pterygoid. It's a nerve to lateral pterygoid. Nerve to lateral pterygoid. D नहीं है बच्चा इसका आंसर. D नहीं है. Just 1 minute. Okay, fine. So anterior division of mandibular nerve gives 3 motor and 1 sensory branch. Motor branches are the masseteric nerve, the deep temporal nerve, and the nerve to lateral pterygoid. Nerve to lateral pterygoid. 1 sensory branch, that's a buccal nerve. The answer for this is deep temporal. Deep temporal nerve is a branch of anterior division of mandibular nerve. बस ये याद रखना बच्चों. Posterior division के lingual, inferior alveolar and auriculotemporal. Okay, fine. Come on students, can you identify this pointed structure? Any guesses? This pointed muscle identify कर सकते हो? Pointed muscle, ये बहुत important visual slide है, देखो. This pointed muscle, any guesses? Come on. Any guesses? This pointed muscle is the medial pterygoid. Medial pterygoid muscle. What is this nerve बच्चों? ये nerve कौन है? Lingual. ये याद रखना. This is a very important visual slide. And ये nerve कौन है? That's the inferior alveolar nerve. Inferior alveolar nerve का दूसरा नाम क्या है? Dentist nerve, है ना? Dentist nerve. इसे anesthesia देते हैं. Around the vicinity of this nerve anesthesia देते हैं to operate on the lower jaw and the lower teeth. So that's the inferior alveolar nerve. बच्चों ये slide अच्छे से देख लेना, याद रख लेना. The lingual nerve, the inferior alveolar nerve याद रखना, and ये जो muscle है, that's the medial pterygoid. And what muscle is this? ये muscle कौन है? Okay, what is this muscle? That's the lateral pterygoid. That's a lateral pterygoid. Okay, and what is this artery? That's a maxillary artery. That's a maxillary artery. This is clear, perfect to all of you, bachcho, perfect. Okay, perfect. Come on, coming to the next MCQ. All the following structures are related to cavernous sinus except. Yes. All the following structures are related to cavernous sinus except. Cavernous sinus के relations बोल सकते हो बच्चों. देखो, that's a cavernous sinus. Yeah, I'll just make this for you. Yes, that's a cavernous sinus. On the medial side, what is this gland? ये है pituitary gland. Medial side पे pituitary gland होता है. And there's an air sinus here. इसका नाम क्या है? Sphenoidal air sinus. Sphenoidal air sinus. Lateral wall of cavernous sinus में ये है third nerve, ये है fourth nerve, ये है ophthalmic division, ये है maxillary division. Ophthalmic nerve, maxillary nerve. What is this nerve? That's a sixth nerve. And ये artery कौन है? Internal carotid artery. So what lies in the floor of the cavernous sinus, students? The sixth nerve and the internal carotid artery. ये होता है floor of the cavernous sinus में. ये है cavernous sinus. हाँ, ये मैंने cavernous sinus draw किया. On the medial side कौन है? Pituitary gland. And what is this? Sphenoidal air sinus. Sphenoidal air sinus. Okay, so medial side कौन है? Pituitary gland and sphenoidal air sinus. फ्लोर में कौन है? सिक्स्थ नर्व एंड इंटरनल कैरोटिड आर्टरी. लैटरल वॉल में कौन है बच्चों? द थर्ड नर्व, द फोर्थ नर्व, द ऑफ्थाल्मिक एंड द मैक्सिलरी नर्व. अब बोल सकते हो व्हाट इज नॉट रिलेटेड टू द कैवर्नस साइनस बच्चों? जस्ट सी द ऑप्शंस. यस, इट्स द मैंडिबुलर नर्व. मैंडिबुलर नर्व इज नॉट रिलेटेड टू द कैवर्नस साइनस. ये बहुत इंपॉर्टेंट एमसीक्यू है. मैंडिबुलर नर्व इज मच अवे, बहुत दूर होती है कैवर्नस साइनस से. दैट्स अ मैंडिबुलर नर्व. This is clear to all of you students. Mandibular nerve is much away from the cavernous sinus. I hope you are getting this. Hello बच्चों. Just wait, let me finish this, then I'll tell you. Okay, ठीक है Dr. Deepa. That's good. चलो, we'll go to the next MCQ. Come on students, आप ये आंसर कर सकते हो. ये बहुत easy MCQ है आपके लिए. Maxillary nerve passes through which foramen? Yes. Yes, बच्चों बोलो. Maxillary nerve passes through which foramen? That's the foramen rotentum. Foramen rotentum. Yes. Foramen ovale से कौन जाता है? You know this mnemonic male, है ना? ये mnemonic याद है आपको? Male. What is M? M is mandibular nerve. A, accessory meningeal artery. L, the lesser petrosal nerve. And E क्या होगा? Emissary vein. Right? जुगुलर फोरामेन के अपने तीन कंपार्टमेंट्स होते हैं. एक है एंटीरियर कंपार्टमेंट, एक है पोस्टीरियर कंपार्टमेंट एंड एक है मिडिल कंपार्टमेंट. चलो बच्चों बोलो, व्हाट पासेस टू द एंटीरियर कंपार्टमेंट? कोई बोल सकता है? इंफीरियर. यस, वेरी गुड. इंफीरियर पेट्रोजल साइनस. इंफीरियर पेट्रोजल साइनस कहां से जाता है? एंटीरियर कंपार्टमेंट ऑफ जुगुलर फोरामेन से. पोस्टीरियर कंपार्टमेंट से कौन जाएगा बच्चा? सिग्मॉइड साइनस, है ना? सिग्मॉइड साइनस पोस्टीरियर कंपार्टमेंट से जाएगा. एंड मिडिल कंपार्टमेंट से कौन जाएगा? द 9th, द 10th एंड द 11th cranial nerves. 9th and 11th cranial nerves. एंड फोरामेन स्पाइनोसम से कौन जाएगा? फोरामेन स्पाइनोसम से जाता है मिडिल मेनिंजियल आर्टरी एंड नर्वस spinosus. Middle meningeal artery and nervous spinosus. बच्चों 40 क्वेश्चन है. 40 9:30 तक होगा. 9:30 तक 40 क्वेश्चन I'll finish. ठीक है, इसलिए I'm going to that speed. So maxillary nerve passes to which foramen? Dr. Deepa, ठीक है बच्चा? Okay. So maxillary nerve passes to foramen rotentum. तो ये foramens are very important. मैंने हर एक टॉपिक से एक MCQ लिया है, which is very important for you. Okay, students, coming to the next MCQ. A 40 years old patient complains of dryness of mouth. On examination, there was absence of secretion from the parotid gland. Which cranial nerves carries parasympathetic fibers to the gland? Come on, बच्चों, can you answer this? Parotid gland का parasympathetic nerve supply क्या है? Which is the nerve which carries parasympathetic supply to the parotid? Come on. Come on, बच्चों, come on, answer. दीक्षांत, गौरव, पारस, कहाँ हो? फरा, आंसर करिए. शंभू, डॉक्टर नीरज, डॉक्टर सूर्या. Yes. Which is the nerve which carries parasympathetic nerve fibers to the parotid gland? That's the glossopharyngeal nerve. Glossopharyngeal nerve. So parotid gland को कौन supply करेगा? Glossopharyngeal nerve. And rest of the glands को कौन supply करेगा? बाकी जितने भी glands हैं, submandibular, sublingual, the lacrimal, the nasal, the pharyngeal, इनको कौन supply करता है? Facial nerve. So वो statement याद रखना बच्चों. All the glands of head and neck are supplied by facial nerve except parotid, which is supplied by glossopharyngeal nerve. Very good, Dr. Deepa. Very good, Dikshant. ठीक है बच्चों. वेगस नर्व क्या सप्लाई करेगा? वेगस नर्व सप्लाइज द ग्लैंड्स ऑफ GIT, है ना? इट सप्लाइज द ग्लैंड्स ऑफ GIT. तो फेशियल नर्व सप्लाइज ऑल द ग्लैंड्स ऑफ हेड एंड नेक एक्सेप्ट पैरोटिड. चलो बच्चों ये आंसर करिए, विच ऑफ द फॉलोइंग इज अ मसल ऑफ सेकंड pharyngeal आर्च। अनदर वेरी इंपॉर्टेंट एमसीक्यू, हर एक टॉपिक से एक इंपॉर्टेंट एमसीक्यू लिया मैंने। विच ऑफ द फॉलोइंग इज द मसल ऑफ सेकंड pharyngeal आर्च? एनीवन, एनी गेसेस? स्टाइलोहायोइड, स्टाइलोहायोइड एंड द पोस्टीरियर बेली ऑफ डायगैस्ट्रिक, जो हमेशा स्टाइलोहायोइड के साथ होता है। So stylohyoid and posterior belly of digastric are derived from second pharyngeal arch. Mylohyoid is derived from the first pharyngeal arch. Mylohyoid. Cricothyroid, yes, fourth pharyngeal arch, fourth. And stylopharyngeus is derived from the third pharyngeal arch. Third pharyngeal arch. Which is the nerve here? Nerve of the third arch, glossopharyngeal nerve. Nerve of the fourth arch is superior laryngeal. हाँ, ये आपको पता होगा ना। Nerve of the first arch is mandibular nerve. Yes, very good. 40 क्वेश्चन है बच्चों। Styloid is supplied by facial nerve. Nerve of the second arch facial, nerve of the first arch mandibular, nerve of the third arch कौन है? Glossopharyngeal, and the nerve of the fourth arch is superior laryngeal nerve, and the nerve of the sixth arch is recurrent laryngeal nerve. Yes. This is very important. The answer for this is stylohyoid. Come on students, answer this. A newborn infant has difficulty in feeding and exhibits impaired tongue movement. Which of the following embryological abnormality can be considered as a potential cause for this manifestation? Yes, impaired tongue movements, मतलब tongue is not properly formed. Tongue is not properly formed. Yes, बच्चों बोल सकते हो tongue कैसे form होता है? ये देखिए, या ना मैं pharyngeal arches ड्रॉ कर रहा हूं। So that's the first pharyngeal arch, second pharyngeal arch, third pharyngeal arch, fourth and sixth pharyngeal arches. In the first pharyngeal arch, those swellings बनते हैं ऐसे. What are these swellings? Known as lingual swellings. इनको बोलते हैं lingual swellings. And पीछे एक swelling बनता है. What is this form? इसका नाम क्या है? Tuberculum impar. Tuberculum impar. So two lingual swellings and tuberculum impar, इससे क्या बनता है? Anterior 2/3 of the tongue, है ना? ये anterior 2/3 of tongue बनेगा from two lingual swellings and tuberculum impar. In the third and the fourth arch, इससे हम बोलते हैं cupula. Cupula. So this is the cranial part. Cranial part of cupula, and ये कौन है? Caudal part. So the cranial part of cupula से क्या बनेगा? Posterior 1/3 of the tongue. हाँ, posterior 1/3 of the tongue is derived from the cranial part of of the cupula. हाँ, ये है cupula बच्चों. So cupula के दो parts होते हैं, एक होता है cranial part, एक होगा caudal part. So the cranial part of cupula से क्या बनेगा? Posterior 1/3 of the tongue. ठीक है, एंड द कॉर्डल पार्ट ऑफ द क्यूपुला से क्या बनेगा? एपिग्लॉटिस. ये है एपिग्लॉटिस. ओके बच्चों, सो इसका आंसर क्या होगा? न्यूबॉर्न इन्फेंट हैज डिफिकल्टी इन फीडिंग एंड एक्सिबिट्स impaired tongue movement. So what is the answer for this? Failure of fusion of two lingual spellings. So tongue is not formed. Failure of fusion of lingual spellings. Malformation of thyroglossal duct. थायरोग्लॉसल डक्ट से क्या बनेगा? थायराइड ग्लैंड बनता है ना बच्चों. थायरोग्लॉसल डक्ट से थायराइड ग्लैंड बनता है. इफ दिस थायरोग्लॉसल डक्ट डज नॉट ऑब्लिटरेट, क्या बनेगा? थायरोग्लॉसल सिस्ट या फिर फिस्चुला बनेगा. ठीक है, दैट्स इट. फाइन. कमिंग टू द नेक्स्ट एमसीक्यू. कम ऑन स्टूडेंट्स, लास्ट MCQs are left. लास्ट 10 MCQs है. कम ऑन, आंसर करिए. ऑल द फॉलोइंग आर्टरीज कंट्रीब्यूट टू द फॉर्मेशन ऑफ सर्कल ऑफ विलिस एक्सेप्ट. यस, एनीवन? Circle of Willis. Chalo, I'll draw this for you. That's the internal carotid, bacha. That's the internal carotid. Yes, very good. The answer is middle cerebral. Very nice. You've answered it so fast. ये है anterior cerebral, ये है middle cerebral, ये middle cerebral, ये anterior cerebral artery, ये internal carotid artery. Very good, huh? Very good. Dikshant, that was very quick. Okay, अब ये बोल सकते हो बच्चों, ये कौन है? वर्टिब्रल्स है ये दो. ये बेसिलर बन गया, ये पोस्टीरियर सेरेब्रल हो गया. पोस्टीरियर सेरेब्रल आर्टरी. व्हाट इज दिस आर्टरी? ये कौन है? पोस्टीरियर सेरेब्रल टू इंटरनल कैरोटिड. इसका नाम है पोस्टीरियर कम्युनिकेटिंग आर्टरी. एंड ये क्या होगा बच्चों, ये होगा एंटीरियर कम्युनिकेटिंग आर्टरी. So now, how is the circle of Willis formed? Anyone? The circle of Willis is formed by one, the anterior communicating artery, the anterior cerebral artery, the internal carotid, the posterior communicating, and the posterior cerebral artery. The artery which does not take part in the formation of circle of Willis is middle cerebral artery. Very good, very good. Middle cerebral artery. Perfect. Very good, bachcho. Chalo. We go to the next MCQ. Broca's area is represented by which of the following? चलो बच्चों ये आंसर करिए. This you should know. Come on students, come on. The last part of the MCQs is left and be active. Come on. Broca's area is represented by. Yes, Dr. Amit, very good. Very nice. Faraz answered, Dikshant has answered. Dr. Deepa आप आंसर कर सकते हो ये. Broca's area is represented by which of the following? That is 44, 45. ये आपको आना ही चाहिए. This you should know बच्चों. 22 कौन है? Wernicke's. Wernicke's area is 22. 44, 45 is Broca's area. And 41, 42 is primary auditory area. Okay. Area number 4 कौन है? Primary motor area. Primary motor area. So Broca's area is 44, 45. Broca's area क्या होता है? Motor speech area. 22 क्या होता है? Wernicke's area. Fine. Okay. Come on students, coming to the next MCQ. A 62 years old hypertensive male forgot to take medicines for blood pressure. Next morning he developed hemiplegia of the right side. A widespread lesion of the internal capsule was diagnosed. Corticospinal fibers pass through which limb of the internal capsule? ये बोल बता सकते हो students? Corticospinal fibers pass through which limb of the internal capsule? Any guesses? It's the posterior limb. Posterior limb. बहुत important MCQ है बच्चों ये. जेन्यू से क्या जाता है? Cortico न्यूक्लियर फाइबर्स. हाँ, ये बहुत इंपॉर्टेंट एमसीक्यू. सो कॉर्टिको न्यूक्लियर फाइबर्स पास थ्रू विच लिम्ब ऑफ द इंटरनल कैप्सूल. अगर एमसीक्यू आता है, इट इज द जेन्यू ऑफ द इंटरनल कैप्सूल. पोस्टीरियर लिम्ब से क्या जाता है? कॉर्टिको स्पाइनल फाइबर्स. एंटीरियर लिम्ब से क्या जाता है? फ्रंटोपोंटाइन. फ्रंटोपोंटाइन फाइबर्स एंटीरियर लिम्ब से जाएगा. रेट्रोलेंटिफॉर्म पार्ट से क्या जाएंगे? ऑप्टिक रेडिएशन. Optic radiation. Okay, I hope students, all of you are understanding this. Students, clear है? That's a very important. और ये visual slide भी देख लो आप. चलो ये visual slide देख सकते हो. Come on बच्चों, answer this. What is this structure? That's the caudate nucleus. हाँ, ये देखिए, ये बहुत important visual slide है बच्चों आपके लिए. Caudate nucleus, ये कौन होगा? That's the thalamus. Thalamus. And what is this? That's the lentiform nucleus. Okay, that's the lentiform nucleus. And what is this V? बच्चों ये देखिए, what is this V-shaped structure? ये है अपना internal capsule, है ना? ये है अपना internal capsule. So ये है उसका anterior limb, ये है उसका genu, ये होगा उसका posterior limb. आप पीछे आइए, पीछे come back. ये कौन है पीछे? That's the retrolentiform part. और नीचे क्या होगा? सब लेंटिफॉर्म पार्ट, है ना? नीचे होगा सब लेंटिफॉर्म पार्ट ऑफ द इंटरनल कैप्सूल. ओके, सो दैट्स अबाउट द इंटरनल कैप्सूल. ओके फाइन. तो ये पीछे होगा रेट्रोलेंटिफॉर्म पार्ट और नीचे होगा सब लेंटिफॉर्म पार्ट. सो सब लेंटिफॉर्म पार्ट से क्या जाएगा? सब लेंटिफॉर्म पार्ट से जाता है ऑडिटरी रेडिएशन. ऑडिटरी रेडिएशन. ओके, come on students, the last part of the MCQ is left. Come on, answer this. Name the mark structure. आप ये देख लो and answer करिए. What is this mark structure? अपन कहाँ पे हैं पहले बोलिए. This is the pons. This is the medulla. आप कहाँ पे हो? आप हो pontomedullary junction पे. We are at the pontomedullary junction. And बच्चों ये हमेशा याद रखना. At the pontomedullary junction there are 3 nerves. What is that? That's the 6th nerve. That's the 7th nerve. And that's the 8th nerve. है ना? So what is pointed for you? क्या point किया आपके लिए? The 6th nerve, abducens nerve. Remember बच्चा, abducens nerve is the most medial nerve at the pontomedullary junction. ये याद रखना. सबसे medial कौन होता है? Abducens nerve. And which is the nerve which is most lateral? 8th nerve. Yes, 8th nerve. And 6th and 8th के बीच में कौन होगा? 7th nerve. 7th nerve. So pontomedullary junction, the most medial is the 6th nerve, फिर आता 7th, and the most lateral is the 8th nerve. Perfect. The answer is abducens nerve. Okay. Come on students, cerebellum is connected to the brainstem by peduncles. Correct है ना? Cerebellum midbrain को कैसे connect होता है? Superior cerebellar peduncle. Pons को कैसे connect होता है? Middle cerebellar peduncle. And medulla को कैसे connect होगा? Inferior cerebellar peduncle से. तो ये तीन peduncles है, they connect the cerebellum to the brainstem. The middle cerebellar peduncle connects the pons to the cerebellum. One of the following fibers pass through it. Any guesses? Which fibers pass through the middle cerebellar peduncle? Answer is pontocerebellar. Pontocerebellar fibers pass through the middle cerebellar peduncle. Olivocerebellar pass through inferior cerebellar peduncle. बच्चों ये याद रखना, ये बहुत important MCQ है. Tectocerebellar will pass through the superior cerebellar peduncle. Cuneo-cerebellar will pass through inferior. Okay. So superior cerebellar peduncle से क्या fibers जाते हैं? That you have to know. Middle cerebellar से एक ही fiber जाता है. That's the pontocerebellar fibers. And the inferior cerebellar peduncle से the cuneo-cerebellar, the olivocerebellar, the vestibulocerebellar, the reticulocerebellar, and the posterior spinocerebellar. बस ये याद रखना बच्चों. This is very important. Okay. Students, can you answer this? A 60 years old woman complains of bitemporal loss of vision. Examination revealed a bitemporal hemianopia. MRI reveals a pituitary tumor compressing the optic chiasma in the region of interpeduncular fossa. All the following structures are related to this fossa except. Any guesses? I'll just draw this for you. ये थोड़ा सा difficult MCQ है. That's the optic nerve. That's the optic chiasma. ये होगा अपना optic tract. हाँ, ये optic tract है. अब पीछे आइए, ये है क्रस सेरेब्रा, ये है मिड ब्रेन, ये है पॉन्स एंड ये है अपना मेडुला. बच्चों आर यू एबल टू सी दिस? दिस इज व्हाट वी कॉल एज द इंटरपेडुंकुलर फोसा. सो इंटरपेडुंकुलर फोसा के बाउंड्रीज क्या है? व्हाट इज दिस? दिस इज द ऑप्टिक ट्रैक्ट. ऑप्टिक ट्रैक्ट ये क्या बाउंड्री फॉर्म करेगा? ऑप्टिक ट्रैक्ट फॉर्म्स अ एंट्रोलैटरल बाउंड्री. व्हाट इज दिस? दिस इज द क्रस सेरेब्रा. क्रस सेरेब्रा क्या फॉर्म करता है? पोस्टोलैटरल बाउंड्री. पोस्टोलैटरल बाउंड्री फॉर्म बाय द क्रस सेरेब्रा. एंड हु लाइज इन द फ्लोर ऑफ द इंटरपेडुंकुलर फोसा? ये है ये एरिया जो है ना, दैट इज इंटरपेडुंकुलर फोसा. एंड फ्लोर में कौन होता है? दैट इज द पिट्यूटरी स्टॉक. ये है, मैं लिख रहा हूं पिट्यूटरी स्टॉक. हाँ, ये पिट्यूटरी स्टॉक हो गया. फिर यहाँ पे दो बॉडीज होती है ऐसे. व्हाट इज दिस? मैमुलरी बॉडी. मैमुलरी बॉडी. एंड यहाँ पे क्या होता है? ये होता है posterior perforated substance. Posterior perforated substance. And what is present in this interpeduncular fossa? बच्चों, why are we discussing this so much? इसके अंदर कौन होता है? ये कौन है? That's the third nerve. Third nerve होता है and circle of Willis होता है. Third nerve and the circle of Willis lies in the interpeduncular fossa. Who does not lie in the interpeduncular fossa is the fourth nerve. Fourth nerve नहीं होता है interpeduncular fossa में. ठीक है. तो क्रस सेरेब्रा कहां पे होता है? इट्स अ पोस्टोलैटरल बाउंड्री. एंट्रोलैटरल बाउंड्री कौन फॉर्म करेगा? ऑप्टिक ट्रैक्ट. मैमुलरी बॉडी कहां पे है? फ्लोर के अंदर. पोस्टीरियर परफोरेटेड सब्सटेंस कहां पे? फ्लोर में है. व्हाट इज द कंटेंट ऑफ इंटरपेडुंकुलर फोसा? इट्स द थर्ड नर्व एंड द सर्कल ऑफ विलिस. इसके कंटेंट्स है बच्चों. सो व्हाट इज द आंसर फॉर दिस? Fourth nerve. Fourth nerve is not related to the interpeduncular fossa. Am I clear, बच्चा? Are you able to follow this? ये देखिए, this area is the interpeduncular fossa. ये है interpeduncular fossa. ये है third nerve. Third nerve. ये है mammillary body. ये है posterior perforated substance. Fine. Okay, चलो, some MCQs left. Can you answer this? Posterior neuropore closes by dash day of intrauterine life. Posterior neuropore closes by 28th day of intrauterine life. The anterior neuropore closes by 25th day of intrauterine life. Yes, if the anterior neuropore does not close, it results in anencephaly. है ना? Anencephaly. Anterior neuropore closes by 25th day. If it does not close, anencephaly. Posterior neuropore closes by 28th day. अगर ये क्लोज नहीं होगा, व्हाट हैपेंस बच्चा? स्पाइना बाइफिडा, स्पाइना बाइफिडा. Okay, so just remember that. Coming to the next MCQ, students, a newborn has multiple congenital defects owing due to dysgenesis of the neural crest. Which of the following cells are most likely to be spared? So ये neural crest cells होते हैं बच्चे. Neural crest cells are derived from ectoderm. ये ectoderm से derive होते हैं and they form the ganglion cells, melanocytes, parafollicular C cells of thyroid. The motor neurons are not derived from the neural crest cells. The motor neurons are derived from basal lamina. Basal lamina. Okay, these are derived from basal lamina. बस ये याद रखना बच्चों. It is derived from basal lamina. Right? So neural crest cells से क्या क्या बनता है? Ganglion cells, the melanocytes, the parafollicular C cells, the corneal stroma, the endocardial cushions of the heart, the skeleton of the face, the parafollicular C cells of thyroid. The motor neurons are derived from the basal lamina. Basal lamina. So the answer for this is C. चलो ये आंसर कर सकते हो बच्चों. ट्रेका इज लाइंड बाय वन ऑफ द फॉलोइंग एपिथेलियम. स्टूडेंट्स, ट्रेका इज लाइंड बाय pseudostratified ciliated columnar epithelium. Pseudostratified ciliated columnar, that's the trachea, along with goblet cells. इसके साथ क्या होता है? goblet cells होता है ना, along with goblet cells, right? Okay, fine, right. Simple squamous epithelium कहाँ पे होता है? Simple squamous epithelium lines the blood vessels, है ना, blood vessels. Simple squamous epithelium lines the blood vessels. Transitional epithelium is urothelium. Kidneys, ureters, bladder, transitional. Stratified cuboidal lines the ducts of the glands. The answer for this is pseudostratified ciliated columnar. Okay. Transitional epithelium is urothelium. Simple squamous epithelium lines the blood vessels. The loop of Henle. Right now? Okay. Yes, very good. Chalo bachcho, last two MCQs for you. Can you identify this slide? It's a histological slide. Spot identification, students. ये मैं बोल रहा हूं आपको, ये है serous acini. एंड ये क्या है बच्चों? ये है islets of Langerhans. What is this? Islets of Langerhans along with the serous acini. The serous acini represents the exocrine part and the islets of Langerhans represents the endocrine part of the pancreas. ये है pancreas. ये आप देख रहे हो, this are the islets of Langerhans, है ना, ये islets of Langerhans है. एंड ये जो एक्सोक्राइन पार्ट ऑफ पैनक्रियाज है, ये है सीरस सलाइवरी ग्लैंड, सीरस एसिनस. So this is a slide of pancreas. A very important MCQ. Come on बच्चों, come on. Coming to the last MCQ for the day. If you can identify this slide for me बच्चों, ये है chondrocytes. And chondrocytes, these are large chondrocytes. सबसे बड़े chondrocytes होते हैं. Chondrocytes ग्रुप्स में होते हैं, छोटे chondrocytes होते हैं, ग्रुप्स में होते हैं. That is hyaline cartilage. ग्रुप्स में होता है, ऐसे chondrocytes ऐसे ग्रुप्स में होता है. इसको हम बोलेंगे सेल नेस्ट. सेल नेस्ट इज अ कैरेक्टरिस्टिक ऑफ hyaline cartilage. इसमें बहुत बड़े chondrocytes दिख रहे हैं. ये पेरिकॉन्ड्रियम है, पेरिकॉन्ड्रियम. So perichondrium present and large chondrocytes are present. This is a slide of elastic cartilage. Okay, that's a slide of elastic cartilage. बच्चों ये याद रखना. So largest size of chondrocytes are found in elastic cartilage. Example of elastic cartilage क्या होता है? Pinna, epiglottis, right? Hyaline cartilage में perichondrium होता है, chondrocytes group में होता है, and matrix is amorphous. Examples of hyaline cartilage: the trachea, the thyroid, the cricoid, and very small chondrocytes. बहुत छोटी chondrocytes होता है. Perichondrium absent होता है. That is white fibrocartilage. And where do we get white fibrocartilage? जहाँ पे बहुत ज़्यादा stress and strain होता है. For example, intervertebral disc, articular disc, menisci. यहाँ पे होता है white fibrocartilage. So perichondrium absent, smallest size of chondrocytes, white fibro. Large chondrocytes, perichondrium present with elastic fibers. Yes, that's elastic cartilage. and hyaline cartilage में perichondrium is present. The chondrocytes are found in groups in hyaline cartilage. Okay, students. So, students, FMG test 1 is on 16th of July. FMG test 2 is 23rd. Test 3 is 25th. Test 4 is 26th. And FMG test 5 is 27th of July. Students, make it a point to answer the test. Enroll yourself and do answer the test. Thank you to all of you. Thank you from the entire team of PW, and all the best for your exam. Students, come out with flying colors, and any doubts, we are there to help you anytime. Thank you once again to all of you. Have a good night and a pleasant night. Thank you. I hope things are clear to all of you. It was a quick revision, students. I know you are very well versed. You are very thorough with your topic. My job was just to put a quick revision. एक फटाफट revision कर दिया अपन ने. Thank you once again and good night. Bye bye.